Because you're going to be very open and honest with them. They all have questions that they certainly would like to ask you some fun. I know we had some recent questions. I have them here.
Being in your role, I'm sure it's super busy. So I was wondering, like, what are your first 2 hours of your day on like an average day to like really set you up for your day?
Okay. So I start the day at 5 o'clock in the morning on my Peloton bike, because if I don't exercise, nobody wants me not to exercise. I'll just put it. So
I know you mentioned retirement. Do you have any plans for retirement? What do you see yourself doing?
So that's great. Thank you for that. I said I'm finishing my doctorate. I had originally thought that I would teach, and no offense to the men in the crowd, but I really wanted to teach women, as leaders, to be empowered, right? To feel that we are equal to the men. I don't know. I love to golf, and I haven't golfed in about 14 months.
What is something you've learned that you wish you knew when you were our age? Yeah. that could have helped you better in the future?
I didn't realize the importance of building relationships. I think I've always been a kind person, and I think I've always tried to have courage, but I probably didn't have the courage in my 20s because I just didn't realize how important it was. And relationships, that's what it's about in life.
What is your favorite aspect of your position and your least favorite aspect?
Okay, so I'm a nurse at heart. I love the patients. I love to talk to the family. I am energized. You'll see me in the ER because I'm an old ER nurse, so I am comfortable in the ER. I love the nurses and doctors. I love the patients. That energizes me. So if I'm having a bad day here, 3-4 o'clock, I'm heading to a hospital. The least favorite part of the job, I would say it's probably the politics. In any job, there's politics. You just have to know how to navigate through them.
When you took this position at Broward Health, what were some goals you had for the organization? Where are you at and going about achieving them?
So one of the main goals was to stabilize Broward Health. I wanted the community to know that this is a good health system.
So if you could change one thing about Broward Health overnight, what would it be and why?
Our reputation.
The healthcare field is constantly changing and evolving. What are some challenges that you've faced, and what have you done to overcome some of those challenges?
I think making sure that our staff has the latest and greatest technology. It's to be competitive because that's what our community needs. Not for anything else, but making sure that we'll meet the needs of the community, and through technology is how we're going to do it.
I was wondering what kind of advice you would give individuals who may not have that years of healthcare experience that's going for an interview.
A lot of hard work. When I tell the millennials that I understand the work-life balance, I get that, but if you're going to get ahead, you better work harder than the person next to you. You really have to, and you have to show that you really, really want the job. You really have to care about people to go into healthcare. I don't care if it's finance, it's marketing, you have to care about people. And you never can lose sight of that everything you do, you're doing for the patient. Everything. No matter what it is in healthcare, the patient is somehow hopefully going to benefit from it.